UGG syndrome. Introduction. Uveitis glaucoma hyphema, or UGG syndrome, is a rare but serious complication that can occur after any intraocular surgery. It is the result of subluxation of the intraocular lens, resulting in damage to adjacent ocular structures and elevated intraocular pressures. Patients typically present with ocular pain, blurry vision, or photophobia. We report an atypical presentation of UGG syndrome in a 71-year-old female who was transferred to our hospital for acute global encephalopathy. Case presentation. A 71-year-old female with extensive medical history including coronary artery disease, diabetes mellitus type 2, and end-stage renal disease on dialysis was transferred to our hospital for altered mental status. Initial head CT was negative for any intracranial pathology such as stroke. She did not receive dialysis for the past week for unclear reasons, and history was difficult to obtain as the patient was encephalopathic. She was transferred to our facility because it was the closest hospital with an available nephrologist. On initial presentation, the patient remained altered and nonverbal, but by the following morning she was more alert with a primary complaint of right eye pain. Collateral information was obtained by the patient's daughter, who reported her mother's eye pain began only a few days ago, with the patient becoming confused and agitated shortly after. It was also learned that the patient underwent cataract surgery 2 to 3 months ago. On examination, the patient's right supraorbital region was consistently edematous, with injected conjunctiva of the right eye, 25% hyphema in the anterior chamber, but with intact extraocular muscles. Ophthalmology was consulted, and the patient was found to have an elevated intraocular pressure in the 50s to 60s. No signs of diabetic retinopathy were appreciated, making UGG syndrome the leaking differential diagnosis, which was further supported by the patient's recent cataract surgery. She was started on IV acetazolamide, topical Combigan, and topical dorzolamide, which resulted in improved pain, but with minimal change in her increased intraocular pressure. Given we did not have access to timely ocular surgical intervention, the decision was made to transfer the patient to another hospital to undergo evacuation of the hyphema. Discussion. UGG syndrome typically presents with obvious ocular pain, photophobia, or persistent blurry vision. In this case, however, it seems to have contributed to the patient's global encephalopathy as well. Treatment for UGG syndrome can be surgical or conservative, but surgical interventions tend to have better outcomes. In our case, conservative treatment was able to alleviate some of our patient's ocular discomfort, but was ineffective at reducing her intraocular pressure, ultimately requiring surgical intervention. Conclusion. UGG syndrome is a rare but serious complication after cataract surgery and should be closely monitored in patients postoperatively. It can appear at any time and should be considered in patients with history of ocular surgery or ocular trauma. The incidence of UGG is approximately 0.4 to 1.2%. If detected, consider surgical intervention as it may be more effective than medications alone.